Hello, my name is Dave, and I'm a physical therapist here at Physical Therapy. I'm also an orthopedic clinical specialist and a level 1 TPI certified therapist as well. So today we're going to be talking about golf. A lot of people believe that golf is a fairly passive sport and it does not require any level of form or conditioning, and you can simply pick up the clubs and go to the drive and just perform really well. That's really not how golf works. If you are serious about golf, if you want to get better at your golf game, or if you have been injured when playing golf, we are here to help you understand a little bit about why that may be happening and hopefully provide some solutions to your complaints of pain. So when you think about golf, you do need a certain level of mobility and strength through different areas of your body to successfully help transfer the energy as it's generated from your foot up into your hands, wrists, into the club as you swing the club. So here at Physis, we have seen several clients who have unfortunately had pain limiting their ability to play golf, which has inspired us to create this video series in which we are going to go through 3 different components. First, we are going to identify which areas are important and which movements are important when playing golf. Second, we're going to help you through small tests understand how and which these movements are. And lastly, we're going to show you some exercises to help restore movement and work on your strength so you can efficiently play golf. Hello, this is Dave again from Physical Therapy. As promised in the last video, we are going to be talking about different areas of the body, different movements required during golf swing, how to check if you have those movements or not, and then we're going to be addressing which exercises you should be doing to improve those movement limitations. The first area we're going to be addressing is going to be the pelvis. The pelvis movements are very important when you go from your static positioning and as you set up for golf, and from that as you go into your swing. So there are 4 movements required at the pelvis. You need to be able to have tilt at the pelvis in both directions, and your pelvis needs to be able to rotate in both directions. So I'm going to show you all those movements. The first one is the anterior pelvic tilt. So you're going to stand with your feet shoulder width apart, relaxed posture, and think about the belt buckle here. You're just dropping the belt buckle down. This is an anterior pelvic tilt. And then as you pull that belt buckle up towards you, that's a posterior pelvic tilt. I'm going to show that to you in the side as well. This is anterior tilt. And this is a posterior tilt. The next movement required at the pelvis is going to be the rotation. So, standing with your feet relaxed, you can slightly bend your knees, and if you want, keep your arms crossed against the trunk so your rib cage doesn't move. So here, holding the rib cage here, knees slightly bent, you're gonna think about bringing the front pocket over to the opposite side. And as you come back, think about bringing the left side front pocket over to the opposite side. I'm going to show it to you again. This is pelvic rotation. This is pelvic rotation to the left. This is pelvic rotation to the right. So if you did the earlier assessment and found yourself lacking movement in either of those directions, let us show you a few exercises to help you with that. So the first thing we're going to be working on is the tilt. The exercise here is going to be, I'm going to show it to you in standing and then in hands and knees position as well. So in standing, you have your feet shoulder width apart, relaxed posture, and all that I want you to do is think about dropping that belt buckle down and and then pulling that belt buckle up. Dropping that belt buckle down, and then pulling it up as far as you can to your comfort. You're going to repeat this for several repetitions in order to get the movements going. The next exercise, same thing, the tilts, but we're going to be doing it in hands in these positions. So, you want to have your knees right under your hips, knees hip width apart. Your hands are right under your shoulders, and you're going to keep your hands nice and open, okay? Feet relax, and here in this position, back and shoulders relax. You're simply going to, again, pull up the belt buckle, and then push down the belt buckle. You try to do these movements as far as you can to the best available range you have. And again, you can repeat this several repetitions at a time. The next exercise that I'm about to show you, there's two variations of it, and that is to help improve your movement in pelvic rotation. So, you're gonna lay fully on your side. The bottom leg, we're going to have the hip and knee in line with each other, and the top leg is relaxed, just straight. You wanna make sure you're not turned in or turned back. Your belly button should be facing straight. And in this position, think about the pelvis right here. All you wanna do is think about bringing it down towards your knee, and then coming back. You're bringing it down towards your knee, and then coming back. You can do several repetitions of the same. You go as far as you can, okay? And then coming back. We're going to repeat this in a slightly more difficult position. This is going to be on your forearms. So you want your elbows right under your shoulders. Leg position is the same. And here, once you are in this position, what I want you to do is same thing. In and coming back. Turning in and coming back. One of the things that I find a lot of our patients end up doing, especially when they don't know what the movement is they'll turn from the rib cage over here. That's not what we want. That's not the movement that we're looking for. You want to isolate the movement right here at your pelvis. So you want to turn from the pelvis. Think about bringing this part over to the opposite knee and then coming back. So I showed you only on the one side, but depending on which side you have the limitation on, you can do it either on that side, or as I advise most of our clients, you want to make sure you train on both sides in order to facilitate the movement properly. Okay. The reason we went through these through the video earlier about the movements that are needed at the pelvis, how to check them, and what exercises to fix them is because we find that lack of mobility in one area will cause compensations, and you can end up having either back pain, hip pain, SI joint pain, or if you already have existing issues, lack of mobility can actually contribute and increase your pain. So make sure you check out all of our other videos. We have upcoming series for what movements are needed at the other areas of the body as well, as we slowly work our way through improving our golf swing.